Women, listen up. The government recommendations for mammograms could be changing.
Well, some patients and doctors are outraged with the government panel saying women don't need breast cancer tests until the age of 50.
Right. NBC6 reporter Ari Odzer. He's live in Hollywood with reaction from locals to the changes. Ari?
Keith, the draft recommendations we're talking about came out yesterday, and they're already stirring up tons of controversy, especially among doctors. And full disclosure, we interviewed my wife for the story, and among breast cancer survivors.
Early and invasive breast cancer. This is a patient who's in her 40s. This is exactly what we look for in a screening mammogram.
Radiologists like Dr. Cherise Odzer of Memorial Hospital have one goal every day: finding breast cancer early enough with mammography to treat it before it spreads. For years, women have been told to get a mammogram every year starting at age 40. Now a government task force is saying wait until age 50 and only get one every other year.
We feel that the adoption of the Preventative Services Task Force recommendations would result in thousands of additional breast cancer deaths per year.
It was a hot topic on the Today Show this morning.
I was diagnosed in my 40s, and you think about all the others that Sheryl Crow was diagnosed in her 40s, and then I think it was, Juliana Rancic, she was at 36.
Add breast cancer survivor Cherise Metz to that list. She thinks the task force recommendation is a huge mistake.
Well, I think it's very scary. I was 46 when cancer was found in me, and that was as a result of a mammogram screening.
One of the big concerns here has to do with insurance. If the draft recommendations become official, there's a chance private insurers won't cover mammography for women between the ages of 40 and 50 and only every other year after 50.
We're concerned that this will encourage women to wait and not get a screening test that could potentially save their lives.
The task force acknowledges mammography does save lives of women between ages 40 and 49, but also leads to many procedures that turn out to be unneeded.
Well, I'd much rather have a false positive and have to go through a biopsy and the biopsy come back negative than to discover too late that I have an invasive cancer.
And Cherise Metz should know she actually did undergo a couple of false positive biopsies before her cancer was found. Doctors are complaining that the task force in this case cherry-picked data to make its recommendations and ignored studies like one from 2011 that showed that if women between 40 and 49 didn't get any mammograms in this country, there would be 6,500 more deaths per year. We're live at Memorial Hospital. Ari Odzer, NBC6 South Florida.